the war against coronavirus intensifies, doctors and nurses on the front line say they're being sent into battle without enough armour.
This is a war that's being waged in our country by an enemy that we can't see, but that can see us. We're asking our frontline staff to go in essentially wearing cargo shorts and a pocket knife.
Melbourne surgeon Sushil Pant is one of thousands of health workers across Australia feeling increasingly anxious after being told supplies of masks, gowns and surgical gloves are already running low.
The number one risk factor now is if you're a healthcare worker. And I don't know how we can ask our staff to continue to go to work without saying to them that we have all of the gear and we will continue to work with you and produce as much as we can in a wartime effort.
Governments and ministries need to be transparent about what the situation is. What are their stocks? What are they doing to get more stocks?
Queensland and New South Wales insist they have sufficient supplies of protective gear, but Paul Torzillo, Executive Clinical Director at Sydney's Royal Prince Alfred Hospital, says he can't find out exactly what the stockpile is in his state.
I don't know how much, and I don't think anybody else in the front line really has that knowledge, and that's contributing to anxiety. So appropriately, people are saying, let's make sure we don't waste it, let's make sure we use this appropriately, and I think there ought to be a lot clearer guidelines at the state and Commonwealth level about these issues.
I'm outraged, and I'm also really scared. We are putting our lives at risk.
GP Mukesh Haikerwal is almost out of gowns and masks at his Melbourne clinic, where he's been testing patients for coronavirus in the car park. He's tried ordering more stock from his normal supplier, but they're out too.
We are at the front line as general practitioners in this space. Unfortunately, we are completely ignored and neglected by the state health authorities and not seen to be part of any planning process. We have had no encouragement. We've had no support, we've had no equipment. That's all being saved for the hospitals, yet we are expected to keep people out of hospitals.
The majority of Australia's personal protective equipment, or PPE, is imported from China, but there are major shortages worldwide. In Italy, Spain and China, the failure to protect health workers has resulted in thousands of staff being infected.
You're all going to see colleagues around us who will fall ill and who may not make it. So although we are willing and able now, it won't take much for our frontline staff to be unable to perform their jobs and eventually perhaps unwilling because they're so scared.
Australia's only local mask manufacturing company is Medcon near Shepparton in Victoria.
With what's happened now, it's just been a total upheaval. Staff, we're hiring people by the day, machines are running 24/7, and we've never seen so much activity in Shepparton.
The federal government has sent 14 Australian Defence Force personnel to join the production line to ramp up the supply of masks and other medical supplies.
Prior to this, we probably had about 5% of the Australian market. We're making about maybe 2 million masks a year, and all of a sudden we're now potentially looking at, with added machines, maybe making as much as 50 million masks a year.
The federal government has told 7:30 it continues to purchase supplies and has already sourced 400 million surgical masks and a range of other equipment. Protective gear is the only line of defence for frontline staff testing infectious patients like Angela's son.
This is what happens when you take a coronavirus test. I've taken multiple tests now.
2 weeks ago, the American journalist tested positive to the virus, along with dozens of other guests from a wedding south of Sydney.
All right, well done. That's it.
I'll be back in the afternoon to let you know the swab result. Yeah.
Thank you.
She spent 5 days at Cairns Base Hospital, where she was kept in isolation and tested multiple times.
Sorry.
I'm thankful for the Australian healthcare system that has been taking care of me. This is definitely a trip to remember.
The 40-year-old was only released after 2 consecutive negative swabs.
Double negative.
The number of cases is growing by the day in Australia.
Morning of day 2 of the coronavirus lockdown.
When musician Dan Williams tested positive, he assumed he picked it up during a recent holiday in Japan.
And I got the results about 2 hours ago saying that I was positive. And yeah, my partner's tested negative, which is awesome, but confusing because we spend obviously all our time together and everything.
But a call from the health department yesterday suggests the holiday wasn't to blame.
I had an interesting call this morning from the health department to say that, or to ask me if I'd been riding in an Uber the morning of March 14th, which I had been, and apparently I was riding with someone that either the driver or someone in the car before me that had tested positive.
Now Dan has to spend the next 2 weeks trying not to infect the rest of his family.
I have to wear a mask in the common spaces apparently, and sleep in a separate room, you know, be vigilant about the hand washing.
Hi everyone, greetings from Doggo and me. It's officially a week since I got to hospital and it's great to be home.
Bridget Wilkins is one of the first Australians to make a full recovery from the virus.
Feeling good, still quite tired. Everyone should be aware that it might take a bit longer to recover than you think.
The 29-year-old spent a total of 13 days in hospital, being cared for round the clock by frontline staff.
And people are planning in hospitals right now how they manage these patients. We've got to know what the state of play is with every aspect of it. We've got to know around beds, we've got to know around ventilators, we've got to know around protective equipment.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.